you have to have good strength and full range of motion, but it would take you 4 weeks to get the strength, then it means you had to have full range of motion at week 4. Is that possible? Actually, it might, but I worked backwards. Hi, everyone. Welcome back to the podcast. Welcome, all new listeners. Welcome back to regular followers, people along the way. Thank you for being part of my journey. Today's topic is how I manage soft tissue healing timeline guidelines. Let me tell you first what's going on in my life. I'll tell you why I got into this podcast and everything about it. So, what is happening in my life? I'm excited actually. I'm going to go on a date with my wife. Yes, a date. I'm excited to do that today. With 3 kids, it is challenging to separate time and focus on ourselves. So, I'm really excited about today. Let's see what else is new. My son is doing fantastic. I don't have Jacob with me today, so if you were on my last podcast, somehow he ended up on my lap during the whole podcast. He actually fell asleep throughout the whole one. So today it is a new week for us at Sports Performance. We finished up some interviews. We're still interviewing for a physical therapist position. We've got a couple small things going on in the background and getting ready for some amazing growth. So very grateful. Let's see, my kids. Son is still in soccer, getting into flag football. I mentioned last week. My daughter Alex is still going strong with gymnastics. And myself, if I haven't mentioned this to everyone, I am like an exercise enthusiast right now. I like love to work out. I try and train 7 days, but that 7th day, my body asks me to just do nothing and enjoy some carne asada fries. If you guys know me, that is my passion. Nonetheless, life is good. All right, why am I doing this podcast? Let me share a quick story. Every podcast, Jacob is in the room with me. Every podcast is very unique based on a story that I have for that week. So for this week, it is about a client of ours, long-term client, and it refreshes my passion about what I do and everything that has led up to the training that I have that I just want to share with everybody on this planet. So I had a client call us on Wednesday and say that he was in the ER and he had a fracture, a clavicle fracture. And he said they're about to discharge me from the hospital and I have no plans, no follow up with the surgeon, no nothing. He's like, is this normal? What do I do? Where do I go? And I mentioned, you know what, I can definitely help. I have the contacts and we can get you all set up. What are you leaning towards? What do you want to do? He's like, listen, I have a swimming competition coming up the next 4 weeks. Can I do it? First of all, I said, let's talk realistic terms about that. That's kind of out the window. What do you need? He's like, I just need to know, do I need surgery or do I not? And I was like, ooh, I can give you an answer, but if you know my world, I refer to us like as chefs, right? Like we're all cooking different things. Like every profession is just a little different. They add little spices here and there. And I'm not the main chef to talk about the surgery. I can give you generally what I have seen, but to get full confidence, I don't want to give you some false positives or false negatives about what to expect. But I think that you really need to talk to a surgeon because I can give you what my guidelines are, but depending on the surgeon that you see, they're going to be the main influence because they're going to be in that joint, in that body part, doing the surgery. So I said, I'll connect you. And I connected him actually that night, got him an appointment the next day, and he's in surgery right now. So within 48 hours, we got surgeon connected, initial visit, follow up with the surgeon, and Friday is surgery. So within 48 hours. And I was talking to a team member. I said, this is like, I love this because this is the world of the pros. You're working in a professional environment. You have this stuff coming at you every day. Every day is something new, whether that's MRSA, eczema, a flu, a fractured clavicle, a lacerated liver, an ankle sprain, spine boarding. I mean, you name it. Something's coming at you every single day. And for some of you, you're like, that sounds amazing. For others, you're like, I don't want that. And that to me is like true being in the sports world and managing people, managing injuries. And and I said managing people. Yes, you are managing the injuries, but ultimately you're managing people, because ultimately that body part is attached to a human, and that human has a goal. And all you're trying to do is facilitate that goal, not heal the body part, help them facilitate to something bigger. And I think sometimes we as clinicians, we hone in on the body part and we just fail to look at the darn human and like, what do you need from this? What do you want from it? So the conversation of soft tissue healing guidelines came up because the client asked, how long is it going to take me to get back to normal? And I said, whoa, there's varying parts of normal, like your daily life, like elite level swimming, like you were before, or 100% to where you feel unrestricted with anything. Those are three different timelines. So if you follow me on Instagram at Chris Garcia DPT, I posed this same image and I said, out of all the clinicians out there, give me your timelines. How long to ADLs, how long back to sport, and how long to perceived 100% with everything, full recovery. And I wanted to give my answers on here because I think it's a larger audience that we can help down the road, not just on Instagram. And for those of you who have different perspectives on how this runs, everyone's going to be just a little different. And I completely get that based on your experience and everything else. So I'm going to give you my guidelines and how I use soft tissue healing to guide everything. It is like the mecca, it's everything that is important to the client, it's important to you, it's important to everybody. It is all about the timeline and how you present that to your patients and clients. So here we go. All right, general timelines for me, and we're not talking about the client case right now. We're just going to talk about timelines. So if you're talking about an acute injury, those first 72 hours are key, right? Just manage the soft tissue healing, the edema, erythema, whatever it is, just manage that in the first 72 hours. If you have pain beyond that 72 hours, you're going to the 2-week mark. So now you're into that subacute phase. You're going to have some swelling. If you're past the 72 hours, you're going into 2 weeks. It's going to take you 2 weeks to get better. If you go on to beyond that 2-week mark, you're going now to the next one, which is 6 weeks. And I'm very confident about that. I've worked with some of the best athletic trainers, physical therapists, MDs, surgeons, whatever you say. And people fit into categories. And I'm just saying that within these timelines, you can answer most questions about the patients and clients that you have. So if you go beyond the 6-week mark, you're going to go down to the 12-week mark. You go beyond that 12-week mark, you're going to 6 months, so, or 4 to 6 months. So when you have these type of injuries, when you're generally talking about somebody who has some swelling, you got to know, if somebody presents to you, how long are they going to take to fully heal? And you have to have that conversation with them, being confident with them. How long is this going to take to heal? Well, what's perceived healing to you? So for this client, we're talking about how long is this person going to take to get to that next level? And you have an elite level swimmer, and I wanted to talk about this. This person is a male, 40 years old, very healthy, elite level, and no comorbidities. That's important to know. Assuming no problems with surgery, how long is this person going to take? All right, so we have a surgical condition that, depending on what they do inside, I totally get that, right? So let's go 72 hours, not going to feel good. 2 weeks subacute, get stitches out or glue, whatever it is. You have the skin healing. From that point, it's range of motion, depending on the restrictions and protocol. From there, you're going to take about 6 weeks to have, 80 to 90% motion and pain actually going down. So when is he going to have pain? When is he going to be pain-free with ADLs? If we work backwards, we're going to do, passive range of motion, active assisted range of motion for 2 weeks, active range of motion 3, 4. He doesn't have, assuming there's no tears or anything else, and we're just doing a plate or pins, ultimately it's going to be passive, active assistive, passive range of motion, active assistive, active range of motion. That's going to take you about 4 weeks. And then for them to get, full range of motion, take you another 2 weeks. So I'm going to say 6 weeks to, normal ADLs, being able to do most things without significant strength, right? To lift a 10, 20-pound box, that's a different story. So most ADLs, grabbing things, eating, brushing the teeth, sleeping, that will be a little different. So I'm going to say 6 weeks. 8 weeks to be able to sleep very comfortably. And the reason for that is just the bony healing timeline, which is going to be about 8 weeks. So from a soft tissue healing standpoint, skin 2 weeks, swelling reduction 4 weeks, range of motion 6, bony healing 8. Now we're at ADLs for most things pain-free, 8 weeks. And then now we go on to what happens to the actual training. So if we get full range in ADLs at 6, we start talking about strengthening 5-6 weeks, uh, light within the pain-free range. They start to actually perform the range with light dumbbells, resistive exercise, whatever your flavor is. It doesn't really matter. You're gonna add in some resistive strengthening. From there, you're going to add 4 to 6 weeks of strength work, right? So let's assume they get at 4 weeks, they have full range, 6 weeks, they have full range, and they're able to sleep on it at 8. At 6, let's assume you started doing significant strengthening, and it's going to take you 6 weeks to build neuromuscular control. So that's 12 weeks. And from 12 weeks, now you're assuming now you want to get them into a pool because you want to get to swimming. Or maybe even you bumped them up at 4 weeks and you did another 4 weeks or 6 weeks of strengthening. You're still the earliest at 10 weeks being able to get them into a pool safely using upper extremities. Now, we didn't even talk about using assistive devices like, where he can float and just, he'll be able to work on swimming after 2 weeks from a conditioning standpoint with just legs. So that's not a problem. I'm just talking about upper extremity use. So in the pool of upper extremity use, you got to have full range and you have to have strength. So you can't get him in before 4. And maybe he has full range at 4, but you're not adding resistance until maybe week 6. So you're in the pool doing light arm strengthening, which is just maybe buoys, whatever it is, and you add some lightweight strength for 4 to 6 weeks. You're at 10 to 12 weeks actually strengthening. You're in the pool, and now you're going to talk about stroke plus resistance. That's going to take you another 4 to 6 weeks. So if we said pain-free ADLs at 6 to 8 and swimming introduction at 10 to 12, he's not in the pool doing full throttle training at least until 4 to 6 months. At 12, he'll be able to do things, but for him to actually get the strength and range and feel very, very comfortable, you're looking at least 4 to 6 weeks from that 12-week mark. So 4 to 6 just to get him ADL pain-free, 4 to 6 to build some strength on top of that, 4 to 6 to actually get him in the pool and working comfortably. So you're doing blocks. Let's say 6 weeks at the latest, you're at 18 weeks. That's 4 months, 4.5 months. So when you're considering these things, I love when I post this question on Instagram, a lot of people are like just throwing numbers out, and they're actually really good numbers. But and I ask people, just do it off the cuff. Just do, like, give me numbers. Don't Google it. Don't do anything else based off your history. And I love it because it's actually pretty close. Some people did 5, 10, 15. Nothing wrong with that. That's actually pretty good because that's 46, 46, 46. And so when you do it that way, you figure about the last little bits that they're actually going to take to finalize the end range components to it, both range of motion plus strength. So what I would say is 6 for ADLs, 6 to start swimming, 6 to master swimming. Not until 18 weeks will he feel really good with swimming. So let's put it at 4 to 6 months for them to feel solid with swimming. 6 at the very end of that. And yes, it's I shouldn't undermine this. It's not just a clavicle fracture, but the magnitude of surgery compared to like a rotator cuff where you have like muscular components and now it's attached and you have repairs, that's a different ball game. The healing is going to be a little longer. So yes, you might be able to get them in sooner, but what you have to do is you kind of have to give them these time frames. You have to be honest with them, because ultimately, especially somebody who's very athletic, you can't tell them it's just going to be 6 weeks and you'll be good to go, which I feel like we naturally do, but you have to be honest with them and let them know why. What is going to be the qualitative components and the quantitative. So yes, you have to be able to have full range of motion, but you also can't do that if you still have 7 out of 10 pain. So you kind of have to have a little bit of both to be able to describe that. So the tips I have for you guys: make sure that the goals that you give them are qualitative and quantitative. That way it gives them both sides of the coin. Um, when you're establishing these timelines, now we said he's 40 years old or in his 40s. So that tissue healing timeline is going to be a little different than the 14-year-old or a 21-year-old. And so with that, you might, like maybe a 14-year-old or a 20-year-old might be on the four-month mark or the 4-week mark at every phase, versus somebody who is 40 might be on the later end of that 6-week mark for every phase. So because of that, give them the furthest timeline and then give them the soonest, and then that way they can kind of gauge that. So basically 4 to 6 months to get you to that point. So with that, consider all the influences: their environments, their comorbidities, their age, their healing, their previous surgery, their motivation, their timelines, everything. So ultimately, when you are looking at these timelines, you got to work backwards, especially from their goals. So the way I process this is I worked with some of the world's best strength and conditioning specialists. And what I learned from them is that they have the opposite mindset of a physical therapist in terms of how things work. They look at the year and they try and work backwards. Well, what do I need to do in order for me to achieve this? And physical therapists think the opposite. They're like, well, it's phase 1. Here's what you have to do to get to this part. And when we get there, we're going to go this way. And then when we're going to get to phase 2, we're going to go now strengthening range of motion. Whereas, you know, in the strength world, it's going to be like, okay, well, if I'm going to be doing certain blocks, what needs to happen in order for them to be there? If they need to jump a mark of 8,200 feet, they need to be able to work backwards and say, okay, what's the actual goal in this phase? If they are going to be working on elastic strength or whatever it is, and then you're going to start at the GPP phase at the beginning, what happens in between there? So when you're looking at somebody's goals, don't start from phase 0. I would say start from the ideal world and work backwards and see if that's possible. So if this person wanted to swim at month 3, is that possible? That's a better way to phrase and answer somebody if they're like, hey, can I swim at 3 months? Okay, well, let's work backwards. That means at month 3, you'd be swimming. You would at least have 2 to 4 weeks of swimming. That puts you at week 8. That means you have to have good strength and full range of motion, but it would take you 4 weeks to get the strength. Then it means you had to have full range of motion at week 4. Is that possible? Actually, it might, but I worked backwards in order to get that answer. And because of that, I think what needs to be happening is you need to change the way that you create goals and that you answer people. It's not from day 0 this way. Try answering it from month 3 backwards. And that will challenge you to have better answers. It's the opposite way that we naturally think. If you went to a certain PT school or you had a certain mentor and you think backwards, good for you. But in general, from a medical world, because we're dealing with phase 0, which is injury, we think this way. Strength conditioning specialists think the opposite because they're not always thinking phase 0 injury. They're thinking of ideal, how do we get to it, working the opposite direction. So have that strength conditioning mindset when you're looking at these things. The other tip I have is be upfront and honest. Once you've done that backwards, give them the bumpers of how much. If it's 4 to 6, it can be 4, but it can be 6. How do you get to 4? You have to have full sleep. Your nutrition has to be solid. You got to be very compliant with your stuff. If not, you're going to 6. That's on you, not me. And when you present it like that, it takes the pressure off of you. I think that most clients and patients always are like, well, my PT, my PT, my PT. No, 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 no. It's on you, not me. You need to do this. But I got to give you the bumpers to put it on you. And the thing that we as clinicians don't do, we don't put it on the patients and clients. Have that upfront conversation. You know who appreciate that? The best patients and clients on the planet. The transparent ones, the ones that deserve that, the ones that want it. But they're trying to reach a goal. Most of the time, if we can't answer that, they're going to leave you. They're going to leave you for somebody else. Why? Because you can't answer their questions. Sometimes the best patients and clients have the best relationships because you're honest and transparent and you look them in the eyes and then you say, I can help you so much, but you got to do the rest. And if you don't do that, you're not going to reach your goal. It has nothing to do with me. It's your soft tissue healing guideline. You got to do this. This is what I'm going to give you. I'll do my end, but you got the other side. And if you don't reach that goal, I will help as much as I can. But no, I'm just as much as in this as you are. Take the pressure off yourself, and people love that. People hate to be dependent on anybody. Think about yourself. You don't want to be dependent on anybody for anything, and neither do your patients and clients. And by giving upfront, honest, transparent conversations, and if you can't have those, it's probably because you don't feel comfortable answering that because you don't know the timelines. So if that's the case, that's a different story. You just got to develop the skill set. Use this framework. You have the strength conditioning mindset. Work backwards. Then look at your normal phases: 4 to 6, 4 to 6, 4 to 6, 4 to 6. And then if that fits within the spectrum, give them the bumpers and say, hey, this is what I need you to do. I'll update your homework every single time when we get there. And along the way, the one thing I will have to say, the caveat is you got to track it, track their progress, and give them updates, and then give them what the next step is and what they have to work on. You can't say, hey, at week 4 we're going to do this, and then don't give them updates along the way. You have to give them week by week updates. You haven't done this, and we're not here. You got 2 more weeks to achieve this. If you don't do this by next week, you're done. You won't be at week 4. You're going to be at week 6. And that way they know along the way if they're going to be successful or not. They don't have to wait for you till week 12 to have magically be pain-free or back to what they want. Nobody wants to wait. They want to know every single week. And you can probably think of the patients and clients right now who are just like that. They're like, every week they want to know. Absolutely. If it was your shoulder, you would want to know too, and they deserve it. So be upfront, honest, track and remind them along the way. And then the magical question along the way, and as you get closer to that goal, is like, what's next? After swimming, what do you want to do? What do you want to do after that? What's the next race? What's the next thing? Because they're not going to be done. And if you've heard my podcast before, don't use the word discharge. Do not discharge them. Help support them along the way. Because if you know they have done 1 race, they're going to want to do 5. And if they want to do 5, they're going to try something else. And you just want to help them continue to stay, healthy and not aggravate this condition. Or the next thing they're going to do, if they're a swimmer, they're going to probably have opposite shoulder problems or back problems or whatever it is. And so you're just constantly challenging people to that next level. And that's with the soft tissue healing guidelines. Naturally, give them the timeline, be upfront and honest, track it, work backwards, and then ask them what's next. What's the next thing that they're going to conquer? And I promise you, the patients and clients that respond well to this are going to be the ones that you love treating. So that is how I manage soft tissue healing guidelines, and I'm really excited about our client who is currently undergoing surgery, and I just wanted to share that story because it's the reason why I love doing what I do. It's triaging, it's managing, it's helping people get to that next level. It's the what's next. So there you have it. My framework for soft tissue healing guidelines, and it can apply to anyone. Just use it. Use the framework, use the template, and then insert whatever spices you want to put on it. You're your own chef. Just add your flavors. Just use the recipe. Use the timeline, and I hope that helps. All right, guys. I will catch you guys on the next episode. I hope you guys are staying healthy and staying active. Take care.